Hi everyone, myself, Allison Farland, Hillary O'Brien, Brittany Burgess, and Lindsay Hayden decided to do our project on baby-friendly hospitals. The focus of this project is the Baby-Friendly Hospital Initiative. An initiative started in 1991 to encourage hospitals and birthing centers to offer an optimal level of care for infant feeding and mother and baby bonding. I'm sure we all saw the hospitals promote mother and baby bonding right after birth when they take the baby and put it right on mom's chest, skin to skin, without cleaning the baby to promote bonding that very moment after the baby comes out of the womb. Baby Friendly Hospital Initiative has grown, with more than 152 countries around the world implementing the initiative. 326 U.S. hospitals and birthing centers in 48 states and the District of Columbia hold the baby-friendly designation as of 2016. The focus of the baby-centered approach is breastfeeding over bottle feeding. The goal in baby-centered care is to initiate breastfeeding within the first hour of life, encourage exclusive breastfeeding only, and breastfeeding on demand. We see breastfeeding on demand in the hospitals by having the mom not follow the clock when she breastfeeds, but she follows the baby's hunger cues. And they've also done away with having bottles and pacifiers in hospitals, unless mom is totally against breastfeeding, to promote using breast is best. So, what are the current standards that make a hospital baby friendly? In our research, we found that having a written breastfeeding policy that is routinely communicated to all healthcare staff is a must. You must train all healthcare staff in the skills necessary to implement a breastfeeding policy. We see that by having hospitals have lactation consultants and things like that to promote breastfeeding with mom, so that way they don't feel alone through their breastfeeding over bottle feeding. They also need to inform all pregnant women about the benefits and management of breastfeeding. They help mothers initiate breastfeeding within 1 hour of birth, show mothers how to breastfeed and how to maintain lactation even if they're separate from their infants. So we see that especially in nurseries where they have the mom come in and pump and they save her breast milk and then they feed that to the baby or feeding the baby formula. So even if the mom's not there, they're still implementing breast is best. They give infants no food or drink other than breast milk unless medically indicated. They practice rooming in by allowing mothers and infants to remain together 24 hours a day. So hospitals have done away with having the babies go into the nursery and having the nursery nurses take care of them instead. So they stay with mom and dad or the parents just to promote having the baby with them and bonding 24/7. They encourage breastfeeding on demand, and this means that the mother is encouraged to feed on the baby's cues. They give no pacifiers or artificial nipples to breastfeeding infants, and that keeps away from the whole nipple confusion scenario that we've all heard about. They foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or birthing centers. So this means that even when mom is discharged, they give them resources to follow up with as far as having like home care nurses come in and help with breastfeeding and things like that so that the mom carries on breastfeeding even after she's out of the hospital. The current best practice for having baby-friendly hospitals is to emphasize breastfeeding over bottle feeding. The US government's goal is to have 80% of women initially breastfeed, then 60% continue to breastfeed for the first 6 months, and then 34% continuing for the first year of the baby's life. They try not to allow babies to have pacifiers or to use bottles unless medically necessary. They encourage bonding by having newborns room in after birth and not send them to the nursery unless there's a medical indication, such as the baby detoxing or the baby being too premature that they need close monitoring. And then they don't send new parents home with free formula unless there's a medical indication. So you used to see the hospitals stack up on formula to send the parents home with, and they've done away with that to try to promote that the breast is best and that's what's best for the baby.
The Global Baby Friendly Hospital Initiative was launched in 1991 by the World Health Organization and UNICEF in response to overwhelming research showing the health benefits of breastfeeding. Full implementation of baby-friendly policies has led to increased breastfeeding rates. This is partly because of the increased education parents are receiving during their time in the hospital. Some reported problems are hospitals not facilitating peer counseling for breastfeeding mothers, lack of referral systems to other agencies that provide postpartum breastfeeding support, and hospitals not having control of the services outside of the hospital, which may lead to mixed information and confusion. Many practices have moved towards the baby-friendly movement to facilitate the gap in clinical settings. However, there are some women who feel pressured into breastfeeding with this movement. Breastfeeding is the single most powerful and well-documented preventative modality available to healthcare providers to reduce the risk of common causes of infant morbidity. Babies who are breastfed have significantly lower rates of diarrhea, otitis media, lower respiratory tract infections, type 1 and 2 diabetes, childhood leukemia, necrotizing enterocolitis, and sudden infant death syndrome. Breastfed babies have lower rates of diabetes, childhood leukemia, SIDS, and other illnesses. The World Health Organization maintains that breastfeeding will help cut child deaths from malnutrition, which is now responsible for nearly half of all the deaths of children younger than 5. Infants who are not breastfed are 36% more likely to die of SIDS, 22% more likely to be overweight or obese as children, and at increased risk for developing leukemia, diabetes, and asthma. As the graphic at the top of the page states, breastfeeding provides the infant with all of the necessary nutrients. It is safe, requires no preparation, and it contains natural antibodies. But some may ask, does breastfeeding benefit the mother? Mothers who breastfeed have a decreased risk of developing ovarian and breast cancers, diabetes, and metabolic syndrome. Mothers who breastfeed are proven to have greater psychosocial attachment to the infant. Breastfeeding improves the mother's metabolism, making it easier to lose weight after delivery. The chart on the right shows reduced percentages of illnesses in relation to breastfeeding. Just to highlight a few, sudden infant death syndrome, 36 to 50% less in infants who breastfeed. Childhood obesity, 15 to 30% less. And acute ear infections, up to 50% less. Breastfeeding is also good for the planet. It reduces packaging, production, and marketing waste, and saves fuel.
Colostrum is the yellowish, sticky breast milk produced at the end of pregnancy. It is recommended as the perfect food for the newborn, and feeding should be initiated within the first hour after birth. Colostrum contains antibodies that help protect the newborn against disease, and without this breast milk, they would not be receiving these antibodies. It also has a laxative effect that encourages the passing of the first stool. Exclusive breastfeeding is recommended up to 6 months of age, with continued breastfeeding along with appropriate complementary foods up to 2 years of age or beyond. Breastfeeding also saves families money. Breastfeeding has proven to save hundreds of dollars of savings at the family level and billions of dollars at the national level through decreased hospitalizations and pediatric visits. For the first month, a baby will consume starting anywhere from 6 15-ounce bottles or so a day for the first 30 days. Following that, for the next 11 months, a baby drinks on average 6 30-ounce bottles a day. The total 1 year savings would be between $1,138 and $1,188. As great as breastfeeding is, nothing is perfect and there is still a downside. The Baby Friendly Initiative can make some new mothers feel pressured into breastfeeding. Healthcare providers understand that some women choose not to breastfeed due to certain medical conditions, medications, psychosocial reasons, or just because they make the personal choice not to breastfeed. The Baby Centered Initiative is so focused on breastfeeding over bottle feeding that women who choose not to breastfeed their babies or women who are unable to breastfeed feel uncomfortable by efforts to push breastfeeding. Recent research has also found that some of the previously reported benefits of breastfeeding may not be as significant as many believe, and that breastfeeding does not necessarily reduce the risk for obesity, asthma, allergies, and ADHD. Breastfeeding can be stressful for women whose babies do not latch properly or whose babies struggle with breastfeeding. Breastfeeding can also cause physical discomfort to women, for example, engorgement, mastitis, blocked milk ducts, leaking, etc. And many women feel pressure to breastfeed over bottle feeding because it is their personal choice to do so. Women who are unable to breastfeed for any reason feel the need to justify themselves to others because of the emphasis placed on the importance of breastfeeding.
So, what is the relevance of this initiative to clinical practice? Well, breastfeeding is obviously beneficial in a lot of ways. So, hospitals are basically trying to promote that for patients, and they give out a lot of resources to women in the hospital to try to promote bonding and promote breastfeeding. But the problem with that is that this emphasis on breastfeeding over bottle feeding can alienate women who have maybe made the decision to not breastfeed or who are incapable of breastfeeding for any reason. And really, although there are like definite benefits to breastfeeding, it's a personal choice. If you feel comfortable with breastfeeding, if you don't want to, you shouldn't really have to explain yourself. And with this huge emphasis and focus on breastfeeding in the postpartum period, it can sort of take you out of the experience and make you feel defensive if you have made the decision not to breastfeed and you're continually bombarded with information that maybe you don't want, or if you feel that it's being forced on you. So I think as nurses, what we need to do is assess each individual patient, and although it's always good to inform patients and give them the best and most accurate information, not necessarily pushing them in any one direction. And maybe when we realize that breastfeeding is not something that they want to do, just take that into consideration and tailor the teaching to that and teach them all the safest and best ways to formula and bottle feed. So, providing patient centered care involves collaboration, teaching, and also follow up with moms and babies. So, as far as collaboration goes, the healthcare team should be providing patient centered care to moms in the hospital, taking into consideration everything that mothers are trying to accomplish in terms of infant feeding and giving all the necessary resources and information about that. Teaching, so there should be appropriate information given, referrals for women who maybe want to take the next step and go to lactation consultants or just get help with breastfeeding, or if they're having difficulty with it, or if they want more nutritional information about other feeding. Obviously, the other option would be formula, just like where people can find these resources in the community and how they can pursue that information. The follow up is really important in terms of infant feeding because the pediatrician should be informed of the feeding habits, what the baby is eating, how they're being fed, how often, if their weight is fluctuating in any way. So, weight should be recorded. Um, and just another thought would be that feeding can be a sensitive issue for new parents. There's a lot of emphasis in this culture now on breastfeeding being exclusive and being the best thing, and it's a personal choice for women. And as we've previously stated, it can kind of alienate you from this whole process and make you question yourself as a parent if you choose not to breastfeed and you're just constantly bombarded with information telling you that your decision is wrong. So the most important thing to remember in carrying out care that is patient centered is taking into consideration the decisions that patients are making and just make sure that they are given the best information to take care of their children in the healthiest way possible. So just to conclude this presentation, the key points would be that the Baby-Centered Hospital Initiative is focused on providing care to new moms, and it is really all centered on the idea that breast is best. Breastfeeding is the best way to promote bonding. It's the best nutritionally. So all of the policies that would allow a hospital to be designated baby-centered are pretty much focused on encouraging breastfeeding. There is a lot of research that supports that breastfeeding is best in terms of nutrition and health, but there's also research suggesting that this initiative can alienate new moms and maybe make them feel negatively about their hospital experience in the immediate aftermath of giving birth if they've decided for any reason that they don't want to breastfeed, or if at any point in their child's infancy they maybe want to stop breastfeeding. So I think that the best way to really care for patients in this type of situation is to take into consideration everything in their background, their psychosocial, their emotional state, what decisions they've made about feeding their baby, and educate them on feeding based on that, and kind of tailor this education about breastfeeding to individual patients.
Police have arrived.
100% breastfed, straight from the source.
Drug-free pull birth. Dolphin assisted.
Oh. Well, you push. We cuddle.
Yeah, cuddling is bonding.
Helicopter mom, 12 o'clock.
Must be mommy's day off.
Oh, that's sexist. What? You wanna go or something? No.
Ow! Disposable diaper. Well, apparently we don't care about the environment.
Oh, look, it's Crunchy Granola Mom.
It's getting real.
I wonder what it's like being a part-time mom.
Ooh. Stay-at-home moms.
I wonder what they do all day.
Mani-pedis.
Looks like some moms are too lazy to breastfeed.
Someone came with their nipples blazing.
Oh, yeah? Well, I pop during conference calls.
Hello.
Yeah.
It's not all about the breasts.
Actually, it is.
No, it's not. No.
It's about.
But it's not.
You want a piece of this? Oh, you want a piece of this? Well, I'll show you some screen-free parenting. Bring it. Nibble up, ladies. It's go time, I think. Yeah, go.
I'll be back.
Let's do this!